Hello and welcome to Prime at 9. I'm Esther. Now for the news in details. Amid the threat of Omicron variant in the country, one inbound traveler coming from outside the state was tested positive for COVID-19 in Nagaland and has been kept under isolation in Dimapur. This was informed by the Principal Director of the Health and Family Welfare Department, Dr. Nikrele Kimau, today during the press conference in Kohima. Kimau informed that the sample of the patient has been sent for genome sequencing and the result is expected to be out in 6 to 7 days. The Principal Director said that with the impending Omicron variant scare, the department has been issuing precautionary measures and advisories to all the districts, health officials said. He also said that the Omicron variant is thrice more transmissible than the Delta variant and for which the department is taking precautionary measures at all levels, especially with travelers coming from outside the country.
With the impending Omicron issue, the department is doing its best. All the orders or advisories, whatever that is necessary, we have been issuing all the necessary informations and orders to all the districts. And of course, with this festive season at hand, a lot of mingling in the given population will take place, and especially with the Omicron variant, which is fast spreading around the globe. And as per the records available with us, if I'm not mistaken, at least 89 countries have been affected with this variant, and for which, even in the country, it is here to stay with us. And this is a variant of concern which is 3-4 times more transmissible as compared with the Delta variant, and for which we are taking due precautions at all levels, especially with travelers or any foreigners that are coming into the country or to the state, and for which we have served advisories to all the districts at the entry point.
We do the testing, do the RT-PCR so that we know the status and we do quarantine, or else we will never know, it will start spreading like wildfire. So that is very important, and a real awareness has to be created among everybody that self-testing, and at least declare yourself, come and do the testing. Maybe you don't have symptoms. This will stop the virus in circulating. So not only that, we are doing genome sequencing, we are sending our samples outside, we are also at par with other states. So we are also keeping in check of whether it is Omicron or whether Delta or whatever other variant, we are working on that. So unless you do the testing, we cannot send a sample. We won't know whether it is Omicron. So it is very essential that testing is done at all entry points, which should be a must.
COVID-appropriate behavior and vaccination. So these are the tools that we have at hand. The clinical management also remains the same, as has been explained by our PD. But one thing is, this festivity season will also bring us to a point where there will be chances of transmission not only of the Omicron variant, but also of the existing variant, which is the Delta variant. So the Delta variant is still the dominant strain here in our country. So the measures, the prevention, the responsibilities which one has to take, avoiding crowded spaces, and maintaining the COVID-appropriate behaviors, and also to vaccinate as and when the time is there for that person to get vaccinated, especially the second dose also.